Good morning, everyone. Dr. Graham Norton here, and I'm joined by Leslie, and welcome to episode 2 of Spinal Health TV. And today I wanted to take some time to talk about stability, in particular stability in the midline, also as it pertains to mobility. So many people will talk about being locked up, feeling stiff, feeling restricted, and one of the most common areas is the hamstrings. You ask them to bend down and touch their toes, or they are performing an exercise and they feel like there's no length in the back of those legs and they just can't move. And you'll often see that people will stretch. They'll stretch and they'll stretch and they'll stretch. And what happens? Well, not much. If anything, it gets a little bit better for a short period of time, and then it goes back to where it was. So the reason in some cases, not all cases, but in some cases that happens is because, in fact, it's a stability problem. So think of it this way. Let's say that the spinal structures need to be really, really safe and strong, and the soft tissues around them, let's say muscles in this case, and the ligaments and the joint structures themselves have to maintain a good quality stability to make sure you're upright, make sure you're safe, and also to prevent injury. Well, if those tissues weren't strong enough and they weren't stable enough, your brain is going to send extra signals down there to tell them to lock up and create stiffness so that you don't hurt yourself. It's a preventative measure, a very smart preventative measure by your brain to try to mitigate the risk of injury, okay? So, number one, that means you probably shouldn't be trying to stretch those muscles dramatically and decrease that stiffness because you could be increasing the risk of injury. But the most important piece of the puzzle is then you need to build stability. So we've talked about different stability exercises a whole bunch, and one of my favorite go-tos with a lot of folks, if it's indicated, is the dead bug. There's different ways to train the core, but the dead bug is one of the great ways to do it. We've done a sample one before, and this one in particular, we're going to show a progression of if you can nail this with body weight alone, how you can just add something like a dumbbell or a kettlebell to increase that resistance and continue to build stability. And something neat that you can do if you're somebody who suffers from that chronically tight hamstrings, do a little forward flexion test where you bend over and try to touch your toes, see how far you can get, and then perform this exercise for a number of sets and reps. Generally, you can do 2 or 3 sets of 8 reps per side, and then retest and see if it's gotten a lot better for you. And if it has, it is an indication that you may in fact have a stability problem, not a flexibility problem. So Leslie's going to be our demo. That was a lot of chatter, I know. Leslie's going to show us how to do the dead bug with body weight alone, and then she's going to add this dumbbell and show us how to do it as a progression to make it a little tougher, okay? So we'll start on the back, as you can see, and you can pretty much do it in any attire, so you can do it at the office if you want to. And Leslie's going to go into perfect 90 degrees and 90 degrees, so a nice reverse tabletop position here. And we've shown some of the baseline progressions. We're going to skip that for today. We're going to go into the full dead bug, which is the opposite arm and the opposite leg extending out while maintaining the brace in the midline. Okay, and then come on back up. So you can see that's nice and controlled. And the cue for Leslie is her ribs are down and her back is relatively flat to that floor. The midline's engaged, and that's why we call it dead bug in this dead bug position. So she's pretty fluid at that. She can do that well. So she's going to show us what it looks like with that dumbbell now. So this is a progression for anybody who's ready for it. So we've got the dumbbell overhead, and just doing the exact same movement pattern, dropping one leg and extending the dumbbell overhead, maintaining that brace. If that low back's really starting to jump off the floor and the ribs are not staying engaged and activated and flush, then this is probably too much for you. You should go back to the easier progression, or regression in this case. So go ahead and do one more. Fantastic. Come on back up. So there you have it. That's dead bug progression with a weight. And remember, sometimes your flexibility or mobility issue is a little bit more than just short tissue. It could in fact be a stability issue. So give that a go. I hope that's helpful for you. And let us know if you have any questions or need any help. Take care.